We'll check. Yeah, that was it. Welcome.
Welcome, everybody, to Fertility Factor Fiction, the just arrived back from Europe edition. I am your host, Dr. Rahi Victory, a double board certified reproductive endocrinology and infertility specialist, with my good off camera friend, Dr. in quotation marks, because he doesn't have a medical degree, Tarek Ibrahim from Ibrahim Strategies.
Oh, you might be on mute. I just realized that. You have to get on mute.
You're killing me, man.
This is part of the fun. Yeah, you're probably on mute. Yeah, you're on mute. Go ahead.
Really nice.
Yeah.
Okay, welcome to Fertility Factor Fiction. I am your host, Dr. Rahi Victory, newly returned from Europe, and I am a double board certified reproductive endocrinology and infertility specialist with my recently discontinued friend, Dr. Tarek Ibrahim.
Salute.
Yeah, who is here doing all things social media. There was some confusion last time because everybody calls him Dr. Tarek Ibrahim, but just so we're clear, he is probably a doctor of social media, but he is not technically a medical doctor, although he has learned a lot and can recognize a lot and new stuff today when I was discussing things. So there were no great articles to share with you, but I did want to have another rant because last week we had a rant about vitamin K. So I have a different rant for you this time, and that's in regards to where I just was. So I was overseas. I was in another country, and I saw a lot of patients because I gave some talks at a conference that was there. And I had the opportunity to speak to a number of people, about 25 different individuals or couples. And the care that these people are receiving was genuinely very, very emotionally draining and difficult for me because, on the one hand, I was so saddened by what they experienced because it was so subpar. And on the other hand, it made me angry because I was like, why is it like this? This doesn't make sense. I saw patients that were young and clearly had endo that were told to go straight to IVF when all they needed was laparoscopy. I saw patients that had made, one couple had made over 40 embryos in multiple cycles of IVF, had failed multiple transfers, and were just being told to come back and try again instead of, hey, let's figure out what's going wrong. I had another lady who had a devastating diagnosis that it literally took me 2.5 minutes to figure out because I had to time each of my consults, so I stayed on time, and no one had advised her. And she can do all the IVF in the world. She's going to have an incredibly difficult time getting pregnant because of what's wrong. And no one's telling them. There was no communication. There was no education. They even said in many instances that they jumped into IVF without even doing testing first. No testing, nothing, like not even an FSH or an AMH. I mean, this is completely crazy. And it was bad enough that when I was giving my talks, and I didn't know all of those details, but I was talking about what we do for endometriosis, it raised the ire of the clinics in that country to the point where we got approached by people at the clinic, one clinic, which should and shall remain nameless, to criticize us and say, what are your intentions for coming here? My intentions are to make things better for people, for patients. Our January success rates for our frozen embryo transfers was 92% pregnancy. 92%. Highest we've ever seen, unbelievable, and we're talking a lot of transfers. I mean, there was over 25 transfers for that month. So we do a fabulous, fabulous job because we pay attention to the details, we focus on the patients, everything else is secondary. This is just like, making money hand over fist in other countries with subpar care. I am totally for making money if you deserve to make money. If you decide you have the best IVF program in the world and you're providing people with a phenomenal success rate, you want to charge $1 million per cycle, great, go for it. Like, that's your choice. You do you. And I'm okay with that. And if people want to choose to pay $1 million for their IVF cycle, that's on them. But what I can't tolerate and what made me really ragey is I don't like the fact that people are getting subpar care and then being charged anything for it. Like, as physicians, we should have an obligation to actually do the absolute best possible, not just even our best, but the best possible. which means you never stop getting better. You never settle. You never allow yourself to be complacent. You never allow yourself to put money in front of medical decision. All sorts of people from our vitamin K video thought I was on the take because they kept saying that, and that I was making money from pharma. I don't get paid by pharma, ever. I don't make money for any of that stuff. And I want to make decisions for patients that prioritize the patient. The patient should always come first. Money should never be the reason we as physicians ever decide to do anything. Sure, I may tell someone impoverished not to do IVF because it may bankrupt them, especially if they're not good candidates for it. But that's me actually saving them money, not pushing them into spending more. So if I think I can help save people money, I will. I'll tell patients that have endo, that are young and healthy and have a high AMH, they can consider laparoscopy. They can try nothing. They can try supplements. There's all sorts of options, IUI, IVF, surgery. No one should be getting railroaded into just keep doing more IVF because they're being pushed into an expensive treatment. And I felt so kind of emotionally drained over the weekend because that's all I kept seeing. Patient after patient after patient that's not getting comprehensive care, that's not getting education, that's not getting the discussion that should be mandatory, that they deserve, that will help them make an informed choice. Everybody wants an informed choice. How can you get an informed choice with no testing being done? Literally none. No AMH, no FSH, no thyroid studies, nothing, just, oh, you need IVF. That's not informed. How can you make an informed choice? How can they even sign their consent form? It was completely irrational and illogical. So we're going to work on what we can do for those patients. I do suspect that we will probably be opening up some kind of operation that way because I couldn't tolerate seeing my own heart rate for those patients there who are not only not getting 92% pregnancy rates or anywhere even close to it, but were being pushed into treatments when they had close to 0% chance of success. That's just immoral. It's wrong. And I don't want to be part of that. I want to make that better for people. So I think we need to start talking more about a revolution in fertility where we take the money out of the equation and the patient still comes first. Just like every other medical field, like every other specialty where money's not part of the equation, and you just focus on actually taking good care of patients. That's what's really important. And again, I have nothing wrong or against businesses that are, legitimate and charging for what they need to charge and making a fair dollar in the fertility world. Great, not a problem. But not at the expense of the patients. Not when you're not informing them and you're not educating them and the communication is terrible. Patient after patient came in saying they made 20 eggs, they got only 10 fertilized, and they ended up with 2 blastocysts. And I said, okay, well, those are pretty bad results. And they said, what do you mean? I said, well, that's like a really low, rate. I mean, the attrition rate from that is staggering. How'd you go from 20 eggs to 10% becoming blastocysts? That's very bad. And they said, no, they told us that was normal. And then I said, well, did they comment on egg quality, sperm quality? No, we got no feedback whatsoever. How do you go through a cycle and not get feedback? We get feedback when the results are good, let alone when the results are bad. So I don't get it. And we need to do a better job because I feel responsible for my colleagues. We as a medical profession need to do better. We need to be honest with patients. We need to educate. We need to inform. Whether it's the doctor or the nurses or the lab, somebody needs to communicate with the patients and give them more info and make this fair for people. It has to be fair. We can't take advantage of people because then they're victims instead of patients. And that's not what they're supposed to be. They're human beings. They have a disease. They need healing. Well, we're not giving them that right now when we don't take good care of people. So hopefully, to the folks in the lovely country I was just in, we will broadcast this to you in the next couple of days. And I hope you're watching and know that I'm here for you. My team is here for you. We will do our best to bring something closer to you, if not right in your home country soon, that will be beneficial for you and make changes. You deserve better, and we're going to make it better.
Like that.
That's my rant.
That's good.
Yeah.
That's very good. Very
Yeah.
good. What a great way to start the questions. Doctors.
Yeah, there you go.
There we go. We started well.
Yeah.
What are your thoughts on HLA testing for both partners? Is DQB or DQA more important? How about HLA antibodies for mom? What are common treatments for HLA issues?
Most of the time for HLA issues, we're doing Neupogen, but for DQ alpha and DQ bravo, we're doing LIT. I think all of those can be important. I don't think it's the first thing I jump to, but it's definitely part of the stuff we look at. So we do that testing pretty routinely here, mainly for patients that have either failed one or two transfers, or they just don't have a lot of embryos, or for the ones that have unexplained infertility and don't want to do more aggressive treatments. Those are all reasonable tests to consider.
I'm in Ontario, Canada, London.
Great.
Do you do IVF at all your locations?
No, we do them with we monitor at all of the locations, but the IVF is done in the Windsor site. But I mean, in London to here, it'd be super easy. We have many, many, many patients coming from London. We are looking at the possibility of doing something in London, but I need a doctor. So if you can find me a doctor in London, I will happily open up an IVF lab there. I am working on it, but I don't have a doctor yet. Yeah, maybe. We'll see if the one that's interested decides to join us.
Start antagonist protocol next time. What are your thoughts? That's it. I don't know. They're just starting their antagonist protocol. I don't know.
Not enough information. I need more details.
Where is it here? Is it detrimental to take norethindrone while doing a Lupron liposol suppression for endo prior to FET?
It's probably not, but there's no evidence for that. So keep in mind, you're going to be giving some suppressive effect to the endo. So it probably is okay, and it will reduce your hot flash symptoms. So it's probably beneficial in that regard, but we don't actually know if it gives you the same degree of outcome because no studies have been done on it. So I don't know what the answer is because there's no science to back it up.
Can I ask me, what practice are you at in Windsor?
What practice am I at?
Yeah, what practice in Windsor?
I'm at Victory Reproductive Care. So I'm Dr. Victory, and our practice is called Victory Reproductive Care. We have a location here. We have one in Sarnia. We have one operational at St. Catharines. And Woodstock should be opening soon. We just have to find our reception. We had one, and then she used us to get a better contract.
Oh, I see.
Which was annoying.
Yeah.
Hi,
Doctors T and V. If a patient has suspected adeno, do you recommend endo protocol for FETs?
Absolutely, yeah. I mean, adeno is the, displaced twin sister of endo, right? So endo is in your pelvis and adeno is in your uterus. It's just endo in the wall of the uterus. So if you have endo or adeno, it does all of the same things that the endo does and is just as inflammatory. And there's actually an even higher risk of miscarriage and implantation failure. So we treat those patients the same way. Are we having camera trouble?
For some reason, it thinks one of those babies are real, so it wants to focus on a baby. Somehow it's deciding that. So I have to just refocus it, but it just keeps thinking that that's real.
Interesting.
All right. How do I get a referral to your Windsor office?
Just have your family doc refer you if you're in Ontario. If you're not in Ontario, just go through the website or contact info, IMFO, at drvictory.com.
All right. TikTok. Could you tell me why I got my periods at 8DP5DT?
8 days. 8DT?
DP5DT.
8 days post-transfer? Yeah, 8 days post-transfer, 5 days DT.
5 days downtown.
Low progesterone, failed transfer. You stopped estrogen too early. I don't know. Need more details about that.
Do you foresee tariffs hurting getting medication in Canada like Duaviv? Duaviv?
That's a good question. Most of those companies have adequate stores here to last a while. I know one fertility company just increased their prices, but they actually increased it before today, so it wasn't related to the tariff increase. I don't know. Companies are companies, they're always looking for an opportunity to make more money so they can jack their prices up because of the tariffs. They will. But I don't know. They probably have enough supply to last a while.
Slow increase in HCG, about 85% doubling 48 hours. Could high TNF alpha cytokines cause a slow increase?
85% doubling? I don't get it. I don't know what that means.
85% doubling 48 hours.
You only need 60% within 48 hours. So if you're above the 60%, you're fine. Could cytokines alter it? Lots of things can alter HCG. Your age alters your HCG. So yes, cytokines could cause a miscarriage if they're too high, or a failed implantation, or a failed bleed, or a miscarriage, but not like the specifics of the beta per se. Nevertheless, if you're over 60%, and I think you are based on what was read there, then you're probably fine. So I wouldn't worry about it.
A very specific question. Your price list mentions no refunds, cancellations for multiple cycle package.
Right.
If I have a cyst or high E2 and the cycle is canceled, would the payment transfer to another cycle to try again?
Oh, yeah. So listen, we wrote that, but we actually don't stick to it that much. So if you purchase a duo stim package or a triple stim package, and then you decide, I'm done after one or two in the triple stim, and I don't want to do my third one, we just refund you the balance. If you show up for day one of stim and you're not ready, we just don't do anything. We wait for the next cycle. We're really not focused on the money here. We really focus very much on you. So that's never been an issue at all. And we liberally let people go back and forth in terms of what they can and cannot do with the finances.
Following up on that question, if only one follicle responds and we decide not to proceed with the retrieval, what happens to the payments?
The payments would transfer to the next cycle. We would charge you for the monitoring that we did, right? So if we did 3 or 4 ultrasounds, we would just charge you for the 3 or 4 ultrasounds of the blood work, but we wouldn't charge you for the cycle at all. You would just roll it into the next
one. What tests are mandatory? It's all one question. I guess it's a very eager patient here. What tests are mandatory to move forward with an IVF cycle? Can we have our doctor order the tests and have them done locally before traveling to see you? Follow up with, do you have any recommendations of where to stay in Windsor when traveling to come to your clinic for an IVF cycle? So they're super.
Wow. Mandatory is infectious disease, thyroid, hormones, vitamins, sperm test, and a saline infusion on a histogram. Those are the ones that are mandatory. You can start them, so not a problem. And if you're that eager, just email info@drvictory.com and explain your situation, and someone will reach out to you. On top of that, as far as where to stay, there's all sorts of places to stay. There's a nice Holiday Inn not far from here. It's about 10 minutes. There's a Hilton. There's the casino, which is really nice. So there's lots of choice in Windsor. There's many places, plus loads of other hotels. But those are the main ones people stay at when they come to us.
Dr. T.
Oh.
And Assistant V.
Oh, they took it there.
They took it there.
You want to swap spots?
No. I'll let my assistant sit there. I'm going to be transferring my last untested 3BB embryo
Okay.
with you in the next few months.
Okay.
If it doesn't work,
Yeah.
how soon could I start a funded cycle? My first was self-pay.
Right now, it's about a 1 year wait list. So talk to your nurse and make sure that you're on the list. As long as you're available, like as long as we have funding available, you can start whenever you want, but the availability of the funding is the issue.
Question for tonight's show.
Okay.
If possible. Well, it's possible. Husband has azoospermia is in the end of that word, but it's
Asthenozoospermia.
Asthenoteratozoospermia.
Okay.
Massive diagnosis. You got to be a doctor just to read that thing. God.
Yeah.
Percentage of progressively motile PR.
Okay.
Morphology normal and viable spermatoza
Yeah.
are below the lower reference limits.
Sure.
Insufficient motile spermatozoa and anti-sperm antibody assessment.
Okay.
This specimen would be classified as subfertile. Is there still a chance to improve sperm quality?
Sure. Watch our sperm video on YouTube. No smoking, no drinking, no drugs, 0. Ejaculate every day or every other day. Take the fertility vitamins. Keep your testicles cold. So no cell phone, no laptop, no hot tub, no jacuzzi. Sit on frozen peas for 20, 30 minutes a day. Don't turn on your car seat. Be delighted. Although the weather's been much milder than it was.
It's warmed up.
It has.
It's warmed up.
It's weird that it's February and it's this one.
It's March.
It's March.
It's March and it's summer. That's it. We're done with it. Snow is gone. Keep that for the people up north. We're done with it. What an interesting question. What is LIT, Dr. Victory?
Lymphocyte or leukocyte immunization therapy, where we take male white blood cells and inject them under the female skin to get her to mount an immune response so that she is sensitized to the male proteins, so that when an embryo lands in the uterus and it's half male, her immune system doesn't attack because it doesn't recognize the protein. That's LIT.
Very interesting question.
Mhm.
Is IVF frowned upon if you are Catholic?
Yes.
Is it? Really? And I know that.
My understanding, and I'm not Catholic, so forgive me if I'm making a mistake, but my understanding is that the church doesn't tell people not to, but they're not encouraging people to run out and do IVF. Although I think it's changing because
It's got to change.
they want babies. So by 2050, the estimate is that 50% of the male population will fall below the normal reference limits for sperm quality. So the problem with that is if half the guys are infertile, the infertility rates are going to shoot through the roof, right? They're already like 15%, and we're thinking it's going to be like 25, 35 by 2050. And that's not that far away. So granted, I'll be an old man by then. I'm already old, but literally 25 years from now, half the world's population is going to be in trouble when they go to make a baby. So if that's the case, we're going to need a lot more ability and capacity. And regardless of your religious background, unless we're looking at decimating the world's population, we're going to have major issues.
Dr. V,
Mm-hmm.
what are your thoughts on the micro-lupron flare or the demi-halt protocol? Would this be appropriate for me if I failed antagonist protocols AFC at baselines 12 to 15, but I end up with a few MAT?
I love the microdose flare, and I would need to know more details because your AFC is quite good. So that doesn't make a whole lot of sense to me. I would want to know, like, did they give you birth control first? Were you suppressed first? Did they do estrogen priming? Like, I need to know details about what happened. But if none of that was the case, they just natural cycle started you and you've got a reasonable dose of medications for whatever your BMI and your AMH is, and you still didn't respond that well, you only made 2 or 3 eggs, yeah, microdose flare can kind of wake up the eggs and give you the push. So can priming, but appropriate priming. So testosterone, DHEA, human growth hormone, stuff like that.
Hi, Dr. T and V. Yeah, yeah. After a chemical of untested embryo, following your endo protocol, should I downregulate again? For how long? Mild endo and adeno.
Not if it's immediate. If it's been like 3-4 months, yes. If it's like a 1 month thing, no.
Is it possible that a failed FET could be due to too much immune suppression? Just had a failed FET, but my first 2 worked, but miscarried. Feel lost.
Yeah, you can't over suppress. You have to remember that some basic function of the immune system is important in the ability of the embryo to stick and stay stuck. So you need to have normal immune reactivity. If there's no immune activity there, the bad bacteria are going to attack the embryo. So you need some normal immune reactivity there. You can't over suppress. Good question.
Hi, doctors.
I don't think anyone's ever asked this.
Yeah, first time I heard it.
Yeah.
I'm on an immune protocol and I'm 6 weeks pregnant. How often do you test immune markers during pregnancy? So nervous after so many losses on immune protocols.
So I don't. I figure pregnancies don't like yo-yos, as we always say, so they don't want to see your levels fluctuate. So I just keep my patients stable. We get them good, we get them pregnant, and then we just level off and keep it going. So yeah, I don't alter the levels. Some of our patients who are well known in the social media community are very public about their affiliation with us and have been on immune protocols, and they've stopped them when we tell them to. So I think you can reach out to them to see what they did, but we tell our patients to stop after 12 weeks, and some of the stuff even earlier, depending on which protocol they're on. Except for intralipids. Intralipids we do continue.
Dr. T, can you ask Dr. V a question?
You're just lapping this up, eh? You love it.
You know, it's part of the, you know, like I'm a doctor and I'm consulting with the master of infertility here. That's what it is at this point.
Although
still learning, student of knowledge.
In Tarek's defense, I was telling him about one of these horror stories from abroad where a lady had had 9 miscarriages. It was either 9 or 11, and she had a septate uterus. And he said, "Don't you cut those?" I was like, "Yeah, we do," and he knew it. Like he knew it, and her IVF specialist hadn't done anything about it.
The Dr. T is not just drama, you know.
It's not just drama. Yeah. You know, I mean, I don't want to start ranting again, but God, come on! Like she miscarried 9 times. You've got to do something. You got to look at it, figure it out. You can't just keep letting people miscarry. That's insane.
I think it was a great trip for you. I think it opened your eyes to room for improvement, the definition of that sentence.
You know, just like it was almost harder coming back here and hearing how well we did. Like I love how well we do. I'm really proud of that.
Sure.
Go team, by the way, to the entire VRC family. Thank you for making us so successful. That's incredible. My amazing team of incredible women. Tarek's our only male guy. He's not technically my employee, but
teamwork.
Yeah, but like it was hard because I'm going from this place with like not great success rates and then horrible care. Like even if your success rates aren't great, but you're providing great care, I can respect that. Like, you know, there's ways to improve and work on it and you get better or whatever. But like bad care and bad outcomes, this is not good. And then I come here and I'm going from like this really weighty, emotionally laden kind of meeting. And then we got a 92% success rate. And I was just like, oh my God, those poor people, they deserve 92 as well. And I was talking to fertility coaches, acupuncture, yoga. We had a great chat with them, right? Like the affiliated people. And they're all like, we want you to come here and do what you do here. Because their clients are ignoring them. I love that stuff. Right?
Yeah.
Bring it all. Everything we can do to make people more successful, bring it. And they're not getting that. And so they were saying themselves, a lot of what they do is just counseling patients. And this will blow your mind, okay? But my friends from Fertilassist were there. And they said, even though they're a testing company, like they don't provide medical care, they said they spend half their time just psychological counseling people that have had a horrible fertility history. Like, that's not a good sign. That's not a good statement.
Scarring.
Yeah, scarring.
Yeah, scarring. It's definitely scarring these people. Question for you, Dr. Victory, about melatonin.
Okay.
A few of us were talking in a chat about it last time, but we never got the answer.
Okay.
I know it's highly recommended in IVF, but every time I try to take one, I have bad dreams. That's the question.
I feel like singing Teddy Swims, man.
That's
yeah. So I've never heard that before, but if you're having bad dreams, don't take them all the time. Yeah. We don't. So we don't know how melatonin works, but almost certainly it works by improving your sleep. And there was just a recent study that talked about sleep that I had already done on YouTube on that like 2 years ago. So we know that sleep is really important for your IVF success, and melatonin helps you sleep. So I don't want people to not sleep well because they're having bad dreams and be stressed, and then your cortisol levels are going up, which is actually quite detrimental. So you got to understand the physiology of this to make a good decision about how to use it.
A lot of people are asking, so I figured it's about time. I've seen it 3 or 4 times pop up now. How do we switch care to your office for IVF?
Just get a referral from your family doc if you're in Ontario. And if you're not, just contact the office. So you can call, it's on the website for any of our locations. You can email info@drvictory.com, or my lovely friend Tarek here has set up a pop-up, a widget. A pop-up little thing where you can ask for a consult on pretty much every page of the website, right? Like it always says, do you want a consult at the bottom? So if you go to www.drvictory.com, we can help you out. Yeah.
I kind of feel like I was there with you. I feel that,
It was really, and anybody that knows me will tell you I'm not an emotional person. I mean, I'm happy all the time, but I'm not like a get sad, cry. I don't cry very often. So that's not me. I'm kind of tough, stoic, work hard, play hard, enjoy things. But it was hard. It was really devastating, like gut wrenching. When I told, so the one woman who I could figure out within 2.5 minutes.
An impressive time, to be honest.
When I told her that it was going to be almost impossible for her to get pregnant and that she would need help beyond just IVF, third-party help, she shut down. And I felt like I was the guy that had sucker punched her and sucked out all the air from the little cubicle that we were in. And she just couldn't talk anymore after that. The only thing I got out of her was, why didn't anyone say this? And I said, I can't understand how no one could figure this out for you. It took me 2.5 minutes. I don't get it. Very aggravating.
It's very aggravating, for sure it is.
That was the one that made me ragey.
Yeah, I bet. It should.
Yeah.
It's deserving.
I took a long walk.
You did, hey? After that?
An hour.
Oh, that's
just a bull. That's steep.
It's a long walk, for sure.
I was not a happy camp.
Doctors T and V. That's actually us.
I'm recognizing that. You've done it so hard that now they're actually routinely saying you first.
It's
And it
the
doesn't
power.
bug me. I just think it's funny.
It is funny.
It is
It
funny,
is
yeah.
funny. It's meant to be funny.
It's
So let me just, in case there's any doubt,
yeah.
I have zero medical knowledge. Just in case the joke got out of hand and some people are like, I don't want him to answer, you want me to answer. I will
Yeah.
never answer.
Well, you've tried a couple of times.
And I've been successful with it,
Yeah.
but I will never write a script.
No, you will not be ready.
Yeah. Okay. For you, Dr. Mickey.
Yeah.
Okay. When omnitrope causes inflammation, extreme joint pain, and swelling
Yeah.
in a patient, does this inflammation affect egg production or quality for IVF?
Yeah, we tend to stop it when it gets like that because those symptoms tend to linger for a long time. So if you're getting really bad joint inflammation stuff, we tell our patients to stop, or we start by cutting the dose in half and seeing if it's still ongoing, and then if it's still ongoing, we stop. So you do have to be careful with that because some people, like even 2 months later, they're still like, my joints are still swollen, and it takes a while for it to fade. It does almost always eventually, but I don't like it when people get side effects, so you have to be cautious.
Statistics in the UK say that 6 IVF cycles result in a 65% chance of taking a baby home. Appalling is what this individual says.
Yeah,
Should I answer that?
yeah, that is appalling. Yeah, I mean, like 92%. But what more can I say, right? Like we are doing so well, and we just keep nudging it closer and closer to perfection. Am I going to get to perfection? No. Is this month better than our other months? A little. But I want to be as high as we can possibly be for our success rates. And so that's the goal. If you're getting a cumulative rate, live birth rate is 65% with 6 cycles of IVF,
Stop.
you're not doing things right. Yeah. Now, granted, in the UK, they have the HFEA, the
It's their healthcare thing.
Human Fertilization or Fertility and Embryo, something like that. I forget what it stands for. But anyways, which is this like oversight body that's governmental, which was created by individuals that wanted to control what's done in IVF because they didn't want patients being victimized, which is good. I support that because they're being victimized in other places. And so they created this traffic light system. So the traffic light system says there's like a green light, which is fine, go ahead and do it, like IVF gets a green light. And then there's like a yellow light, which is caution when proceeding. And then there's a red light, which is there's no evidence for this, so you probably shouldn't be doing it. And then there's a black light, which is, yeah, you're not allowed to do that.
Oh, not allowed.
Right. Like
Well, not allowed.
You're in, contravention
Danger.
of their regulations. And they license the fertility centers. So if you're doing something they don't like, they pull your license and you can't practice.
Oh, wow.
Right. So, I mean, I think they've made it harder for people to do what they want to do, but there is a workaround. Like, you got to have really detailed consent forms and put in the evidence and say, there is or there isn't evidence for this and it's experimental and whatever. And then the patients get to make up their own minds. So I kind of get it, but not enough. So we are going to the UK in the next couple of months. We will be opening up VRC UK.
Hey.
Yeah. We did I tell you we checked out the clinic?
Oh, no, you didn't mention that.
Yeah. We went to the clinic. It's quite a nice clinic on the inside. It's very chic. It's very modern. It's very comfortable. I met the embryologist. I met the doctor that'll be covering for me when I'm not there. He was me.
No way.
Totally me. Lisa
So
said
cool.
it. Some other people we know there said it. Like, he's totally me. So I'm super excited because he's very nice. He's very gentle. He's a smart guy. He knew his stuff. There's a couple of things we do differently, and he was super eager to learn them.
Amazing.
Yeah. And Fariba, actually, our lab director this week, went to another city in the US where there's this massive fertility center to visit with them to see what they were doing because she had met with their doctor and he said, yeah, come and visit and learn how to do the stuff we do. And then she wrote him to thank him and say, thank you for showing me all these things. And he said, no, we learned more from you than you did from us.
Wow.
Yeah, so if you want cutting edge, we're the place to be.
It's a good team over here.
It is a very good team. And there's some super exciting stuff, hopefully just weeks away, that'll be starting. So, yeah.
Just don't forget, team starts with T.
For TAR.
Yeah.
I should say to all of you, and I probably should have announced this prior to the rant, but hopefully you're all still watching. So, for those of you that have had multiple recurrent pregnancy losses, failures, miscarriages, failed implantation over and over and over again, in some cases, even with donor eggs, there is new testing available commercially now from a company that allows us to test all of the genes in your embryo. So not just PGT, this is whole genome sequencing. You can get every gene that's in your embryo. And some patients have lethal genes, either in the testicle or in the ovary, that will always contribute to a terminal fetus, meaning a baby that cannot continue. And they can actually analyze that now, which we could not do until 2 weeks ago. So now that that's available, if you want us to help you and that's your history, you should reach out to us and we will get that processed relatively quickly. And if you have genetically abnormal embryos that are frozen, that's actually a great way to figure it out because then you don't even have to do a new IVF cycle. I can use those embryos and figure it out for you. So please let us know if that's the case. And we can tell you what's needed. You would need to ship your embryos to us. We can test them, send them off, and figure it out and get you answers that are incredibly, incredibly valuable for those people so that you're not wasting cycle after cycle after cycle.
T-licious. Yeah. And Dr. V. T-licious ain't bad, I'll be honest. That's
pretty good.
It's pretty good.
Now you're on camera. How many years were you off camera?
Forever.
5 years?
I just remember my wife has friends recently that just told her, hey, by the way, your husband knows something about fertility? Because, some people just swipe, right? They're just swiping by. So this rumor of me knowing fertility continues to grow.
It continues to
grow. Yeah. But I'm not going to answer this question, honestly. I'll leave that for you. For your priming with DHEA, HGH, and testosterone, what doses usually? My clinic is refusing testosterone. Is there a study I can show them?
There's meta-analysis on testosterone, so it's not just a study. There's dozens of studies. DHEA is 25 milligrams 3 times a day. We use androgel for the testosterone, so that's 12.5 per day. And human growth hormone, we use 2.5 milligrams. 8 units.
What are your thoughts on a suppression shortened protocol with Lupron 10-21 days before an FET for suspected endo?
Proven useless. There's no value to that whatsoever. Even 3 months of Lupron prior to an FET is useless. So don't do that. You should never do something useless.
Is there any harm in doing Neupogen wash if you don't have elevated NK cells but do have RIF?
No. The studies on RIF for Neupogen show that it's a 40% increase in live birth for unexplained failures. So no, there's nothing wrong with that. It's fine.
What is that testing called? They're asking. The one you just mentioned.
Whole genome sequencing, WGS, whole like WHOLE, genome sequencing. Yeah. And we're currently, I think, the only ones providing it in Canada. So contact us and we'll help you out. Very, 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 very cool technology. We got to do a whole segment
about it,
on that.
I think it'd be great.
Yeah, it's going to be really cool. Yeah.
Does morphology matter?
Morphology of what? The sperm or the embryo? If it's the sperm, yes. If it's the embryo, very much yes.
Dr. T.
That's it.
That's it. It's just
not even a comment.
You are not in this question
I'm not
whatsoever.
in the question.
You're not here.
Maybe it's a social media question.
Would you recommend vaginal probiotics? Your thoughts on seed lactobacillus crispatus?
Yeah. So, are you taking that, Dr. T, or do you want me to take that?
Well, my thoughts.
I think we're going to need to go
Who
back.
wants my thoughts?
I think we're going to need to go back to you.
No.
Re-announcing that you are not technically.
Yeah, so let me get a disclaimer. I simply run the cameras, guys.
You're going to need a disclaimer at the bottom that says, I'm not actually a doctor.
I just like to be
I
here.
just like to be included. Yeah, seed lactocrispatus is great. We love that. We use it quite a bit. And the first part of the question was,
Your thoughts? Vaginal probiotics.
yeah, we use vaginal and oral all the time, like for every case, pretty much. So yeah.
Do Lupron side effects go away after stopping it?
Well, depending on who you ask, yes. So typically speaking, they do. There is a group of about 4,000 or 5,000 people called the Lupron Survivors Group, I think, online. They are not happy about Lupron. I once commented about it and got torched just for even talking about using Lupron. Like I wasn't saying anything good or bad or discounting anybody's experience. I just said we use Lupron, and they were like, "You're a criminal and you should be shot." And so then I spoke to one of their members who was like, "Yeah, we've all had devastating side effects." And so, depending on who you ask, there shouldn't be any significant long-term side effects, but there's a large group of people that says there are. So that's all I can tell you. The research does not show long-term effects. But 4,000 people is kind of hard to argue with. They were, do you remember that?
I absolutely remember that.
And I said, let's do a Zoom and I'll meet with everybody. I mean, obviously not 4,000 people, but it was open to as many people as wanted to show up. And I just want to listen. Like, I'll listen to your experiences. Let's do research. Let's figure out why you're different from people that don't have these permanent symptoms. Yeah, they wouldn't let me in the group.
Sometimes to be part of a group is, you gotta really.
They wouldn't let me in. They literally said, no, you can't come into the group.
You're unworthy.
Why? Yeah, I didn't understand that one. I mean, I think some people are so angry they can't hear anything other than what their experience is, right? And I respect that. I mean, if you took something and you had this horrible side effect, you'd probably be pretty pissed off. I get it.
A lot of questions.
Uh-huh.
Battle on TikTok over whose doctor you are, Chel's or Carly's. They don't know. It's a little bit uncertain terrain there.
On the doctor book? Yeah.
They're saying one only.
I gotta pick.
You don't have to pick, but they're claiming that, they got dibs there.
Yeah.
Yeah, leave it.
I love them both.
There you go. Yeah. That's the safe answer.
Yeah.
However, Carly did ask a interesting question.
Uh-huh.
What would your ideal last meal be?
What would why are you planning to kill me? I think some of the people in Ireland are planning to kill me after what happened at that conference.
Absolutely.
My ideal last meal. Wow.
Big one.
That is a big one. Anything my wife cooks.
Look at this guy.
She's an amazing cook, and I love spending time with her. So, I mean, if I actually had to physically pick a food, she makes pasta sauce that's to die for. You throw some shrimp or Italian sauce it down in heaven.
That's it.
Yeah. No. And I'm not a big pasta guy, but
when she does it,
it's amazing. Yeah. Plus, I get to stare at her, and she's beautiful, so that works for me. It's It's just a really holistic
Whole thing.
moment.
It's an experience.
Yeah, it's a good moment. Yeah.
Dr. T only.
Dr. T only. Okay, yeah.
Yeah, for sure. I'm reading this question right now. I'm like, up the wrong streak here. Should I take additional supplements to my Flow Vita tablets? Sure, why not? Just go nuts with the multivitamins. Why not? That's my opinion. What do I know?
Yeah, my non-medical opinion.
Yeah, that's right.
Yeah, so you can overdo it with vitamins, but not just a few more than the full vitamin. You can take way more than just what's in full vitamin, but you can't overdo it. So we use vitamins to reduce what's called oxidative damage. But if you take too many vitamins, you can actually do something called reductive damage. So that may not be beneficial. And actually, there's someone that's producing a product. I don't want to get into specifics, but we were having a chat recently, and I said, you know, you may have actually too many vitamins in there. It might actually be detrimental taking this because you kind of packed it and it's very nutrient rich, but it might be too much.
So,
is that on you?
This is on me right now. Yeah, go ahead.
Yeah.
So I started juicing with normal juices.
I remember that.
Yeah.
Are you still doing that?
I'm still doing that. I haven't
You're
done it.
still juicing?
Oh, I'm definitely juicing.
Okay.
Not steroid juices or muscle juices. That's not my style.
Yeah.
But just normal fruits and veggies or whatever. And I'm telling you, if you put too many fruits and vegetables together without that fiber,
it's not a good experience.
You're not feeling good all day. So I can only imagine on a pill what that concentration looks like. Because my juices are hardcore. Like there's no joking around with the ingredients I'm putting in there.
I want to know what Carly's last meal would be. Carly, what would your last meal be?
I'm sure she'll answer.
Also, how's your adorable baby?
Question. I have an important question. That's how it's introduced. I have an important question.
I like that. Yeah.
Yeah. We will absolutely ask the important question.
That's even better than Dr. B and Dr. T. Yeah.
Well, that's your opinion. You get asked Dr. V all the time. For me, it's a weekly occurrence.
It's a weekly.
Yeah. At home, I get called out many other words. But here, I'm a doctor. Respect.
Yeah, listen, man. At home, none of us are carrying our names.
None of our mates are making it in.
The front door. Yeah.
Yeah, they're gone. When I go to my parents' house, there's even new names being introduced, but we won't get into that. What does rare cells for immune reactive for the plasma cell marker CD138 detected mean? I had an endo biopsy done and the labs just came back. So
it's suggestive if you have more than 6 to 8 for a high powered field that you have chronic endometritis or acute endometritis, whichever. But that there's some degree of endometritis there. It's actually a really crappy test, and I don't believe in doing it. So for all those of you that are getting endometrial biopsies, please stop. It's useless. Pathologists don't agree on the definition of endometritis, let alone on the ability to analyze the slides. So it's really not a good test. You should be doing PCR testing. Does BMI affect implantation during a FET cycle? Massively. Huge. 80% reduction in success for women whose BMI is over 35. About 40 to 50% between 30 to 35. So it is very significant. Question about when did you come back from Ireland? About 3 hours ago. Yeah. Fresh off the plane, drove from Toronto back to here. And came here for the show. Made some videos with Tarek, which were funny. We did the mean tweets videos where I had to read stuff that some of the people that were being very mean to me said. So that was quite humorous. That'd be great. Diagnosed with unexplained infertility, husband had 2 hernia surgeries years ago. I guess they're asking if that impacts. It could. I mean, if they damaged the spermatic cord, it could, for sure. Get your husband tested. Make sure he's being tested. Look for endometriosis. 44% of women with unexplained infertility have it. I mean, we very often can figure out why people are infertile. The fertility assist testing has helped quite a bit. So it could be your microbiome, it could be your immune system. We have advanced sperm testing here now. Some of the stuff that Fargo was telling the guy in Chicago he'd never even heard of before. So that was kind of cool. So yeah, we do hyaluronic acid sperm binding. We use Myoxis to look for oxidative and reductive stress. We do sperm aneuploidy testing. We do DNA fragmentation. We do overnight survival. Like there's all sorts of advanced sperm testing that's available. And we're getting something brand new, very, very, very new technology, very exclusive technology that will let us analyze sperm DNA fragmentation and still use that sperm, which cannot be done currently.
Wow.
So we're just about to get that started. So some really cool things happen.
Do you specialize in VBAC?
In VBAC?
Yeah.
Yeah, sure. I do VBACs all the time. I don't know that I specialize in it. Any obstetrician can do a VBAC. I've done thousands of VBACs. Yeah.
I haven't done any.
Yeah. No,
just to put it out there, you know what I mean? It's important to know. I haven't done my share of VBACs.
Yeah. Oh, by the way, for all those of you who are watching, I want some feedback. I don't know how we got there, but I do actually know how we got there. You know what? So in the vitamin K video that we did, which had like over 1,000 comments, at some point somebody said, I, meaning me, and probably the same type of doctor that says that oxytocin and pitocin are the same thing, and then it went on from there, and people started talking about natural birth. So there was a whole thread that said that there are women who have natural, or what they like to call physiologic births, and have no pain. So I probably delivered somewhere north of 10,000 babies. I suspect it's probably closer to 15, but whatever. I've delivered a lot of babies, okay? Thousands upon thousands of babies. I've never once seen a woman not have pain. Like, it may be not that bad. They're not all screaming and rolling around and stuff. Some are not. But I've never seen a woman that went, yeah, no problem. Like, launched out the kid and said, okay, what's next? Like, that's just never happened. So how many women watching this show, I want a show of hands, like a thumbs up or something. How many of you had no epidural, no narcotics, no gas? You went through a natural pregnancy, natural labor. You did one of these physiologic births and you had no pain. Not a lot of pain, because that's subjective. No pain, like you felt nothing. It was like going to buy groceries. That's my question.
That's a great question. Let's see who responds to that.
Yeah.
Let's see who responds. The responses.
You know, we could actually make a post.
That's a great one.
On that.
Give me the epidural, one individual says.
Give me the epidural. Yeah, I mean, I would want an epidural. Listen, I've had kidney stones, and they say that kidney stones are slightly worse than labor. That's what women who have had natural labor and kidney stones say. Not me. And I've had kidney stones so many times, and I know what it's like. So I would want an epidural. I mean, how you endure that and call that pain free? Like, you had kidney stone.
2 epidurals.
Yeah. Could you endure that for 14 hours?
If I may rehash my kidney stone story, just for the sake of telling a great story, I went into the hospital barely walking because my kidney stone had it showed up out of nowhere, basically. I'm just kidney stone, and I didn't even know what it was. I actually was quite convinced I was dying. I'm dying. I'm about to die. Goodbye, family. It's the end for me. Go to the hospital. Obviously, unfortunately, I waited quite a long time before the first medication came. So I walked up to the nurse or doctor, whoever it was there. I'm like, hey, I need something for this pain. This is massive pain, man.
Yeah.
He's like, no problem. Let's give you a syringe of, what is it? What do you get? Morphine. So he goes around. He's like, all right, and I have to hound him down. Like I'm like that annoying patient, for sure, annoying patient. I acknowledge that. And I grab him, like, I didn't get it yet, and I need it. Like, so shoots it in. He's like, you'll be feeling better within a minute. I'm like, okay. 5 minutes go by, still dying, complete death. I go up to the guy, I'm like, hey man, it's not working. Oh, are you sure? Yeah, I think I'm still dying here, like I'm still on the verge of death. So he goes, okay, let me give you another one. Shoots another one into me. I'm like, oh. I walk up to him again. I'm like, you know what? I think whatever it was is gone. Like, I think I'm cured. He's like, no, man, you're high as hell right now. You are on cloud nine on motion. So,
My
yeah,
first one.
I'm never, ever, ever like feeling pain. I'm against it at all costs. Like, if there's medicine to take away pain, give me 4.
So you and I share the common trait that our livers are pretty virgin.
Yeah, yeah.
And so I don't take drugs, I don't smoke, I don't drink. So when I got my first kidney stone, I was just screaming in pain, like literally screaming.
It's very painful.
Right? Oh, it was horrible.
Very
I couldn't
painful.
breathe. And they gave me 10 milligrams of IV morphine in the ambulance.
Oh, wow.
Which, for someone naive, should just
knock them out. Yeah,
I was still screaming when we got to the hospital.
Morphine's weak.
It was not helping me at all. Like, I felt tired, but the pain just like
it's massive pain. Then it put me to sleep. Like, I woke up and I was just sleeping the whole day after that.
Yeah, I hate that dark cloud feeling.
Oh yeah. Wow.
All right, dude, I gotta get home to my.
Hold on. There's one question that was asked 15 times from Charles. I think I can.
Oh, okay.
We'll give it for Charles. Don't worry, Charles. I see it. I see you. I see you, Charles. I see you. Have you ever heard of pregnancy causing neuropathy? Nobody seems to know about my frozen toes.
Yeah, I've been talking to Charles about her frozen toes. So, only if your epidural dinged something. So if they hit a nerve with your epidural, yes. Or if your legs were up in the stirrups for too long and the side of your leg was pressured against something, that would do it too. It's called the common perineal nerve. And if your common perineal nerve was compressed for too long, that could do it.
She's saying she had the feeling 2 weeks prior to labor.
No, your camera.
Yeah, it's okay. You're still you're the main show.
2 weeks prior to labor, you had that. That's weird. We need to get an MRI of your back, Charles. Just reach out to me. We'll figure it out. And let me know if you got your other testing done. Okay, I gotta go because I'm exhausted and I need to sleep. It's whatever, 2 a.m. for me now. So
welcome to Canada.
Yeah. So to those of you watching in Ireland, first of all, I love your country and your people are magnificent. They're warm, they're friendly, remarkably beautiful. The men were beautiful, the women were beautiful, super nice people. Our good friends Will and Val were there and we love them. Thanks for coming out, guys. And thank you to Lisa for all of the planning. So it was an amazing opportunity to meet so many great people, a lot of great people in the fertility industry as well. And the folks at the Future Fertility Show, fantastic. Loved every minute of it. Very emotional. So I need to help you guys get better care. And I don't know why I've suddenly decided to make it my life's mission, but yeah. So we're going to get you better care. We're going to hold people accountable and we're going to find ways to get you better care. We're going to set the standard and make sure other people live up to that standard. No more kind of flying by the seat of your pants as a patient. Yeah. I don't want to disparage fertility clinics, but fertility patients deserve what they deserve. So that I can speak to, and we're going to try and get you guys the 92% we've got here. Have a good week. Next week, I'll be coming back from Australia. I don't know what time I'm back next week, but we'll figure it out. But I made it this week, so
always impressed.
Back next week.